my name is Dr. Masi Hashemian from Park-Based Dentistry. In this section, I want to talk about prevention. How can you, or what can we do to stay away from trouble in dental office, basically? So, maintenance. Maintenance is the name of the game. You can develop a brushing and flossing schedule for yourself to maintain things. For example, after each meal, you need to brush with the proper toothbrush, not too hard, proper technique, using the right toothpaste for yourself. Flossing is very important. Sometimes people say, I use mouthwash, can I not floss? No, they are not interchangeable. Basically, flossing gets in between the teeth where the brush cannot reach, and you're cleaning the sides of the teeth with flossing and removing the sticky plaque that builds below the gum. If you do that brushing and flossing and hopefully use some mouthwash also, you can maintain and lengthen the life of the restorations in your mouth, or hopefully you don't have any restorations, so you can keep your teeth perfectly cavity free. Now if you do have any restoration, for example fillings and crowns and root canals, things like that, then you need to make sure that you take care of them as well. Sometimes people say, it's not my tooth, it's a crown. It is your tooth under a crown. So it actually needs more of your help. You need to brush and floss even more. If you have to choose one tooth to take care of, would be the one that has crown and root canal. So it's hard to see any problem under the crown unless it's too big on the x-ray. It's important to have your proper oral hygiene to maintain it, and then hopefully you go a couple of times a year to your dentist and make sure that they go around the teeth, make sure nothing new starts under the crown or on your natural tooth. Your regular cleaning is very important. Regular periodic x-rays, especially on root canal teeth, is very important. Remember, root canal teeth don't have any sensation, the nerve is out, so you can never tell if there's a problem there. Only when it's too late, when you could wake up in the morning swollen because you had an infection, never felt anything about it. It might not even hurt at that time. It could be only swollen there without any pain, and that's because the nerve is dead. So you got infection and without knowing about that. So that's why it's so important to allow your dentist to take x-ray on your teeth, especially the ones that are root canal. So if there is any failure in the root canal, any new infection, they can address it before it gets out of hand. Also, one thing that I'm very adamant about is preventing cavities to begin with. On top of our chewing surfaces of the back teeth especially, we have these grooves. They're normal. The younger we are, the more pronounced these grooves are. These grooves are almost like hairline. Bacteria can crawl there very easily. Doesn't matter how hard you brush, what you use for brushing, you can still end up getting cavity there. Usually it starts by staining. So you could see on top of your back teeth that there are some dark lines, and people think it's just a stain. Maybe it's a stain, or maybe it's start of a cavity. It's hard to tell. What you should do is ask your dentist to put some sealant on. Sealant looks like a clear nail polish. Frankly, it's the cheapest thing you can do in dentistry. You need to ask your dentist to put some sealant on the grooves on the back teeth. Sometimes the front teeth have, on the back side of them, have deeper anatomy. It would be prudent to put the sealant there to block out bacteria. If you don't do it, it's just a matter of time. Chances are on the chewing surfaces, bacteria crawl underneath and start developing cavity. They're kind of like termites in the house. They start with a little hole. As they get in, they start to decay. Once the bacteria enters the tooth, it starts to decay from inside. From outside, you might not see, you might not feel, even the dentist might not see. It takes months, maybe a year before the x-ray shows anything going on there. That's why prevention is so crucial. For the sealant, the dentist has to clean the grooves first, and then put the sealant, which is again like a clear nail polish, put on and block the bacteria out. That's to me a very cheap investment, but very important to prevent getting any cavity on your teeth. In between the teeth, you still have to floss, and you're the one who can help yourself. Top of the teeth, chewing surfaces, your dentist can help you. Hopefully this information proves to be good for you and prevents a lot of problems in the future for you and your family. Thank you for listening.